Meanwhile, new monkeypox cases continue to pop up across the state. It's being primarily spread by men who have sex with other men. A vaccine can't prevent breakouts, but the CDC says the current supply won't meet the demand. Fox 4's Macy Jenkins has more on the push for more vaccines. Macy.
Hi, Steve. Well, there have been a total of 76 cases of monkeypox reported in the state of Texas over the last month. 28 of them are from the North Texas region. Now, doctors say that the best way to prevent this or treat this is with the vaccine. The issue is not everyone who wants one can get one.
You know, it's less linked to international travel and national travel and more spreading within the state now.
About 5 weeks ago, the first known case of monkeypox in Texas was from a patient in Dallas who had traveled from Mexico and, according to Mexican authorities, previously traveled from Europe, where the global monkeypox outbreak began. By Friday, the statewide case count reached 76. All of the known patients so far have been men.
The majority of the cases we are seeing are indeed gay and bisexual men or men who have sex with men. That seems to be the community that it is spreading in right now.
The monkeypox vaccine, if administered within 4 days of exposure, can protect someone from getting sick.
This is, unlike some vaccines, the vaccine can actually be effective after someone has been exposed to and contracted the virus.
But those doses aren't widely available right now. There's only one safe vaccine on the market, and it's made by a Danish company. On Friday, the Biden administration says it ordered another 2.5 million doses from that company, bringing the total doses coming to the U.S. to 5 million in order to meet demand. But
they're expecting to arrive over the next several months, maybe by the end of the year or early next year.
There have been reports of shortages in other states like New York, where monkeypox is more widespread. As a result, Friday, the Biden administration also announced it would distribute another 131,000 doses from its current supply. But an exact number wasn't set for Texas.
It's not that they're shipping, 10,000 doses to Texas and we're managing that. It really is, okay, Texas, here's your supply. We've got it here set aside for you. Let us know when you need it, and they ship it right out.
Chris Van Dusen with the Texas Department of State Health Services says there is enough vaccine to meet demand in Texas right now, but it's only being given to people who've been exposed. A small shipment coming to Tarrant County next week is earmarked only for those people. So if you're someone who thinks you may be at higher risk of exposure, it's likely you won't get one right now.
Now, as we go down the road and even more doses are available, we may be able to expand that out and start vaccinating other people who may be at higher risk.
Now, the Biden administration also announced efforts to increase testing capacity, which has been very patchy. In the beginning, the U.S. could only process about 6,000 tests per week. The CDC has paired with 5 companies to increase that to about 70,000.